I was told to, or asked to, just talk for about 5 minutes about what I've been doing since my first MRDA. So I'm going to try to stick to 5 minutes, although I might go just a few minutes over. But my research focuses on designing and developing interventions to promote emotional well-being for families of children with congenital heart disease. So as you may know, congenital heart disease is the most common birth defect, and about 25% of those born with congenital heart disease have the critical form, which is often, but not always, diagnosed prenatally, followed by neonatal hospitalizations, in many cases cardiac surgeries, an unpredictable medical course, and the inevitable separation from parents as parents have to go back to work and take care of other responsibilities while their baby's in the hospital. Fortunately, there have been dramatic improvements in survival for patients with CHD due to medical and surgical advances over the last several decades. However, neurodevelopmental and psychological problems are considered to be among the most common morbidities of CHD survivors. So generally speaking, across studies, we find that about 50% have some form of neurodevelopmental delay or deficit, and there are increased rates of ADHD, learning disorders, anxiety, depression, and other things as well. We also know that CHD affects the emotional well-being of parents and families. So a recent systematic review found that across studies, over 80% of parents included in research reported clinically significant traumatic stress symptoms, and that was across all of this was published in 2017, so it's a few years old, but it was a systematic review of all the research that was available at that time reporting mental health symptoms in parents of children with congenital heart disease. 30 to 80%, depending on the study, reported severe psychological distress, and about 25 to 50% report depression and anxiety. And so why are we focusing on the family? Well, we know that parent emotional well-being and family functioning are very closely linked, and both influence child outcomes. So in 2014, I obtained my first MRDA. I did actually have two, one in 2014 and one in 2015. But in 2014, the goal was to develop grant proposals to better understand the needs and experiences of parents and families impacted by congenital heart disease in order to inform interventions to promote emotional well-being in parents and families following the diagnosis of CHD, which we believed would thereby alter the developmental and behavioral trajectories for children with CHD. So in 2014, I submitted an Excel pilot grant I think it was for the 2015 year. That was not funded. I did end up getting a pilot grant 2 years later, but I'll get to that. I also submitted a Society of Pediatric Psychology pilot grant, which was also unfunded, and then I submitted a Menda Heart Foundation pilot grant, which was funded. Menda Heart Foundation is a foundation run by parents of children with congenital heart disease. They do fund research studies. It's also a community organization, and so these are folks that have lived experience with this and felt that this was a very important topic. I had funding from this foundation from 2015 to 2016, and this was really the first funded grant that I had in this area where I was the PI. Again, I really attribute this to the MRDA and the support that I had through that and my mentorship from Ann Kazak, who's my primary research mentor. This was a mixed method study exploring parent perspectives on the experiences and needs of families of children with CHD. With qualitative or mixed methods research, often the sample sizes are smaller. You get an immense amount of data from each participant. We did 1 hour semi-structured interviews. So what we did in terms of identifying participants was we identified 25 diverse families to invite to participate from all different backgrounds, including Amish families, Spanish speaking. And then of those 25 that we approached, 21 agreed to participate. And we had 20 mothers and 14 fathers from those 21 families. We also conducted a card sort activity or task where we had parents actually use cards that had intervention components on them and design their own ideal interventions in terms of what they would want, whether it would be individual, group, at what timing, who would lead it, who would participate. And so we got a lot of really great information about what parents want in terms of interventions, as well as just other supports and what their needs are. And so we've published 2 papers so far from this project, one in Pediatric Critical Care Medicine and one in Journal of Pediatrics, and then we have a third that we have just submitted. This project then provided preliminary data to obtain an Excel pilot grant in 2017. This is 2 years after I had originally applied, and I think a much better proposal to collaborate with the University of Delaware, MUSC, and congenital heart disease patient and family organizations to continue this line of work. So this pilot grant applied online crowdsourcing methods to collect qualitative data from parents of children with CHD and leaders of CHD community organizations to understand the experiences and needs of these families and to inform intervention and care practices to improve outcomes. So, a lot, the overall focus of this was similar to my prior project, but that was families just at Nemours, interviews. This was much broader in terms of what we asked about. We collected data over 6 months from a group of parents from across 45 care centers, as well as community leaders who provided support to parents in terms of what they thought was needed from across 16 organizations. If you're not familiar with crowdsourcing, this refers to the process of generating ideas and solving problems by soliciting contributions from large groups in the form of online communities. Like I mentioned, we had 2 virtual crowds of stakeholders. We used a platform called Yammer, and ended up with 108 mothers and fathers from diverse backgrounds from 45 care centers and 16 leaders of 5 organizations. These were the organizations that partnered in this effort. We posted questions over 6 months to each crowd, and they addressed, the questions were structured into 10 domains. We had a large team from across institutions and including parents to help us to develop these domains as well as develop the questions. And I'm not going to go through each of these, but these were the things that our team felt, based on literature and based on the lived experiences of the parents on our team, were important for addressing the psychosocial needs of families. This is what it looked like. So we would ask a question, we post a question. They could have the Yammer app on their phone, respond via phone, or on the computer, respond via email. But we asked things like, what do you wish your child's care team had known about you and your family? What got in the way of them knowing this? And then, we had up to 108 responses for each. They responded to each other. They would like each other's responses. It was very interactive, and it really did have that feeling of participating as a crowd and really working together to solve problems in the way that we would expect in crowdsourcing. So that project then provided the preliminary data to apply for a position within the, there were 5 funded slots within the PedsNet Scholars K-12 program that were funded by AHRQ. And I did obtain one. This was available to junior investigators across 8 pediatric health systems. And Nemours, was one of the 5 that was selected to have somebody be funded by AHRQ to participate, which was great. The goal of this was to partner with parent stakeholders as well as multidisciplinary clinicians across the 8 health systems involved in PedsNet to design a stakeholder-driven intervention to reduce anxiety, depression, and traumatic stress in parents of children with congenital heart disease by intervening at the time of prenatal diagnosis. So we heard from parents in our last couple studies that that's really a window of opportunity where when parents do get a prenatal diagnosis, they have about close to 20 weeks to, in many cases, to prepare and adjust. And there's really insufficient supports for the psychosocial needs during this time, although there's certainly a lot of support for the medical aspects. And we heard from parents that these were the 4 intermediate outcomes that needed to be addressed through the intervention during pregnancy to promote long-term positive outcomes in parents and families and eventually in the children themselves. So we needed to reduce emotional distress, reduce social isolation, increase parenting self-efficacy, and increase hope. So we recruited 2 virtual crowds of 50 diverse mothers and fathers. We had 1 English-speaking crowd and 1 Spanish-speaking crowd. That's where the 2 crowds are. They were across the 8 pediatric health systems. We had clinician collaborators help to recruit diverse parents across these health systems. We also had 4 parent research partners on the team who participated in study calls and helped us to design the questions and design the intervention. We posted questions to collect qualitative and quantitative data that inform the selection of the meaningful outcomes that I mentioned before, those 4 outcomes, as well as the design of the intervention, which we have called Heart Prep. This is just a graphic that shows that the intervention is 3 modules. Each module has a primary outcome that it focuses on, but we do expect that all of the outcomes will respond to all of the modules. And then we have a secondary outcome across all modules of increasing hope. And this is all delivered before the birth of the baby, but after the prenatal diagnosis of congenital heart disease. And it will be built into an app. So it'll have telehealth components, app-based components. It'll have recorded brief videos from other parents talking about their experiences, as well as other educational materials. So in terms of next steps, I am a research project leader for the Nemours co-group proposal that was just submitted in January. Ann Kazak and Melissa Aldifer are the multiple PIs for that to establish the Research Expanding Access to Child Health Center, the REACH Center. So if funded, the first go around, this would begin in December 2021. And my project would be to refine and pilot heart prep. So have it built into the app. The plan is to partner with the Nemours Center for Health Delivery Innovation to build the intervention into the Nemours app, which is already used by tens of thousands of Nemours families for medical record access and telehealth and communication with clinicians. And so this would be building a special heart prep dashboard and all of the features of heart prep into that. So we would be refining and piloting heart prep within Nemours across both Delaware and Florida. And then by the end of the second year of that grant, if funded, I would be applying for an R01 to NHLBI for a multi-site RCT, which would also include postnatal child outcomes, which is not currently included in the COBRI. So that's my plan. Thank you all for listening, and sorry if I went over the 5 minutes.